Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. Here we are learning the very beautiful and high yield content and concept that is much necessary for your upcoming Norcet 8 exams and all other central government, state government exams. Very importantly, it's also helpful for our upcoming RRB nursing superintendent exams. So these only the high yield questions and concept are repeatedly striking, and some of the students which who all are repeatedly making the mistake to identify the question. So studying from the master nursing classes makes you a person and makes creates a ability in you only so that you can differentiate the options very easily, right? So Norcet will throw a question like they will give orange, so you people have to say whether orange is a fruit or orange is a color. So here the master nursing classes is helping you to decide when we have to choose orange as a fruit and when you have to choose orange as a color, right? So that is the difference for other classes and master nursing classes, because the experience matters in the teaching, right? Yes, without wasting the time, we will start the today's class. A very good morning to everyone. Welcome you all once again to the master nursing classes. If any one of you are watching my videos first time, so please do subscribe to the channel. Your one subscription matters a lot to us. And if you love the content what I'm giving here, if you found the previous content classes what I have given to you people are helpful, please press the like button now. Yes, who are on live to the session, so please press the like button now. We will continue the class with a beautiful motivational quote. Yes, the beautiful motivational quote is here. That is, it's hard to take a first step for the study. So it is hard to everyone to take a first step towards your study. But once you took the step, so it will ends up you to become a knowledgeable person, and it ends up you to with a something great learnings. So when the exams are near, so don't study the 100 books. Just listen to the person who studied the 100 books as your mentor and guide here, right? So without wasting the time, we will start the today's class. So the first question of the class is here. A very good morning to everyone. Very good morning to everyone. So who all are live to the session, please hit the like button, and the subscribe button is also free for everyone. Please hit the subscribe button, and to get notification for the all daily classes, you people have to press the that bell button also, which is given beside of your particular subscribe button. Yes. So here is the first question for you all. So the first question is, the chest tube insertion site for draining a hemothorax is typically located. The question is very simple. The question is related to the site of insertion of the chest tube in case of the hemothorax. So what is the correct answer? Here I am giving you a current completely updated answer in your some competitive books. Still you people will read the old guidelines, and you people will comment in the video that sir we have studied this one and you have said this one. Believe me bachcho, this is the completely updated guidelines answer I am telling in front of you people. So believe this one, believe me, and choose the answer as what I said. So that definitely makes you become a particular rank and highly qualified candidates in your exams, right? So yes, the question is, the chest tube insertion site for draining the hemothorax is typically located in option A, that is in the midline below the sternum. This is absolutely wrong answer. Option B, in the mid axillary line at the fifth intercostal space. Yes, it looks correct. Yes, it looks correct. So in the mid axillary line at the fifth intercostal space, we have to insert the chest tube in case of the hemothorax, right? So option C, in the mid clavicular line in the second intercostal space. This is the a space for insertion of the needle for the needle decompression. In case of pneumothorax, that is especially in the tension pneumothorax. Don't worry, I will discuss what is the pneumothorax, hemothorax, everything, and the difference, how you people have to choose. I will clearly explain here. Don't have to worry about that one. Okay. So this is also not our answer. And this, the mid clavicular line, second intercostal space, this one is the according to old guidelines. This one also in the tension pneumothorax also some update is there. I will tell in the next question. Don't worry. Okay. So then option D at the sixth intercostal space. So it's not correct answer. I am eliminating the option D also. So let me choose the correct answer. That is the option B is the correct answer. In the mid axillary line at the fifth intercostal space is the best space for insertion of the chest tube drainage catheter, okay, for the hemothorax. So now tell me the answer and few golden point chanting related to the hemothorax. Sir, what is hemothorax? Bacho, consider this is the lung, right? Let me take a clear diagram of the lungs so people will like get more clarity. Okay, this is the right lung with the three lobe, and this is the left lung with the two lobe. Okay, so surround the lungs we are having the cavity. The name of the cavity is the, yes, the name of the cavity is the pleural cavity. If in case in this particular pleural cavity the air accumulated, consider the air accumulated, we call this one as in the pneumothorax. If in case in this particular pleural cavity, the blood is accumulated. We call this one as in the hemothorax. The blood is called as hemothorax. The air is called as the pneumothorax. Right? If in case in this particular pleural space, the pleural, what we can say, the lymphatic fluid is accumulated. Lymphatic fluid is accumulated. So I call this one as in the chylothorax. What I can say this one I can say as a chylothorax. Yes, let me revise completely and quickly. In the pleural space, blood accumulated means we call hemothorax. In the pleural space, air accumulated means we call hemothorax, sorry, pneumothorax. And in pleural space, lymphatic fluid accumulated means we call this one as the chylothorax. And most importantly, okay, so in this particular situation, everything, whatever which is accumulating air, which compresses the lung towards upward. Okay, why? Because the lung tissue is softer as compared to the our pleural cavity tissue. Okay, it's very important for the studying these things, right? So here the chest tube insertion site for the hemothorax means the best answer is the mid axillary line fifth intercostal space. Okay, so let me come for the next and updated question on the tension pneumothorax. So the question is here, when inserting the needle for the tension pneumothorax, the preferred site is. So what is the preferred site? Option A is telling the mid axillary line, fourth intercostal space. So this is the mid axillary line, fourth intercostal space. This is our, yes, phlebistostatic axis. We have studied this phlebistostatic axis in the yesterday's class. So this is the fourth intercostal space, mid axillary line, where the transducer or the zero of the our manometer which we are using to monitor the central venous pressure should be equalized at the phlebistostatic axis. Okay, we have studied that one in the yesterday's class. So this is not related to the our needed decompression in the tension pneumothorax. Okay, so then comes the option B, the anterior chest at the second intercostal space in the mid clavicular line. So anterior chest, second intercostal space in the mid clavicular line. So this is according to the old guidelines correct answer. Okay, this is according to the old guidelines, correct answer. So it is having the highest failure rate because I am inserting the needle from the anterior chest, means here I am having the pectoralis major muscle, then pectoralis minor muscle, then the intercostal muscles. The bulk of the muscle will be there, and length of the needle we should insert more deeper to reach the our pleural cavity, right? So there is highest chance of the failure rate is there in this particular anterior just second intercostal space. So the new guidelines of the advanced trauma life support says the best site for insertion of the needle in the tension pneumothorax to uh, to do the our what we can say needle decompression. So the best one is the fifth intercostal space anterior to the mid axillary line is the first best answer. Okay, this is the first best answer. If this one is not in option, you people can go. This is as a second best answer as a correct answer. Okay, so this is in the 10th edition of the Advanced Trauma Life Support. So there they have mentioned this one. Yes, it's a fifth intercostal space anterior to the mid axillary line. It's one very important. Okay, so in the case of the needle decompression, okay, to insert the needle for the tension pneumothorax. So let me clear this medical emergency, that is the tension pneumothorax. What it actually means? The tension pneumothorax, what it is actually means? It isn't simply a condition. This is the lung and this is the pleural cavity around the lung. Okay, so here because of the some barotrauma or because of some rupture of the bullae in the lungs or because of the some complication of the emphysema empyema, so the air will leak into the pleural cavity and air will keeps on filling in the pleural cavity and there is no place for the air to escape. Okay, air enters into the pleural cavity and unable to escape. So here the air keeps on building like this and it will immediately collapses the lung. So our lungs become like this much only. Okay. So this is what we call as the tension pneumothorax. So air will enters into the pleural cavity and unable to escape from the pleural cavity. That is the tension pneumothorax. So this is the medical emergency. So here immediately I don't have the time to insert the chest tube. So here we have to do first this tension pneumothorax. I need to convert to the simple pneumothorax. Okay. So this tension pneumothorax should be converted into the simple pneumothorax immediately. Okay. This is the first priority. So to convert tension pneumothorax to the simple pneumothorax, the first thing I have to do is the needle decompression. Okay. That is the needle decompression. So what it means, sir? Means I have to immediately insert a needle in the second intercostal space, anterior axillary line, which is the old guidelines. Now I have to insert the needle in the fifth intercostal space. Okay, in anterior to mid axillary line. Very important. This is the new guidelines. Note it down in your notebook, right? So it's very important. So here also the question is asking the same thing. While when inserting needle for the tension pneumothorax, means in the tension pneumothorax, first priority convert the tension pneumothorax into the simple pneumothorax, then use the chest tube. Okay, so here I am doing the needle decompression. Okay, the preferred site is the D is the best answer. That is the fifth intercostal space anterior to the mid axillary line. That is the perfect answer here. Okay, hope the concept is clear to all of you. Okay, so the next question is the triangle of the safety is a concept used to insert the chest tube. Which of the following is not a boundary of the triangle of the safety? So here in the option we have given the boundaries of the triangle of the safety. So one boundary which is not a part of the our triangle of the safety. So that one all you people have to choose here. Okay. So option E, lateral border of the pectoralis major muscle. Yes, this is a part of the triangle of the safety. And anterior border of the latissimus dorsi muscle. This is also a part of the triangle of the safety. And the fifth intercostal space. This is also part of the triangle of the safety. And mid clavicular line. This is not a part of the triangle of the safety. So the correct answer here we have to choose is the not a part of the boundary of the triangle of the safety. Means mid clavicular line is not a part of the boundary of the our triangle of the safety. Sir, what is this triangle of the safety, sir? It is a triangle made by the imaginary lines here. Okay, this is what is the our a pectoralis major muscle, right? This is what our pectoralis major muscle here. The chest muscle, the big chest muscle, we can say. Okay, and this is what our latissimus dorsi muscle. Okay, this is the latissimus dorsi muscle, right? And here is the fifth intercostal space. Okay, this is the fifth intercostal space here. Okay, so superiorly a base of the axilla, inferiorly fifth intercostal space, and anteriorly that is the lateral edge of the pectoralis major, and posteriorly there is the lateral edge of the latissimus dorsi, so which creating a triangle. This is called as the triangle of the safety. So this is the best site for insertion of the intercostal drainage. Okay, so where there is a less chance of the damage to the nerves, muscles, and major blood vessels will be there. So the least chance of the damage to the nerves, major blood vessels will be there when we insert the particular catheter in the triangle of the safety. So the boundaries of the triangle of the safety is most important. That is the yes lateral border of the pectoralis major. Yes, consider this one lateral border of the pectoralis major muscle. Yes, correct one. And the second option is the anterior border of the latissimus dorsi. This is the latissimus dorsi, and this is the anterior border of the latissimus dorsi. Yes, this is also a part of the triangle of the safety. And fifth intercostal space is also triangle of the safety. Okay, the midclavicular line is not a part of the triangle of the safety. So it's not very important. The question on the triangle of the safety. Okay, identify the device. Yes, I am waiting for your answer in the comment box, bacho. So please do identify the device name which is I have given here. Fatafat. You people have the very less time for the exams, so your answer should be very quick and very fast and very accurate. Okay, not only quick and fast. I need the accurate and best answer. Yes, this is the image of the intercostal drainage tube. This is the image of the ICD tube. Okay, very important. This intercostal drainage tube or ICD tube we have to insert in the this particular triangle of the safety in order to remove the air, the accumulated blood, and accumulated lymphatic fluid, whatever it may be. If you want to drain from the pleural cavity, we have to insert this intercostal drainage tube in the triangle of the safety. So that will replace us the negative pressure in the our particular pleural cavity. Okay, so that is most important. Okay, the examiner many time asked what is the primary purpose of the ICD insertion. So that is to replace negative pressure in pleural cavity. Bacho, in the pleural cavity, normally we are having the negative pressure. But in case of the pneumothorax, hemothorax, chylothorax, that negative pressure may get lost. So by inserting the ICD drainage tube, again we need to replace that lost negative pressure. Okay. Yes, the negative pressure which the patient lost because of the hemothorax, pneumothorax, and chylothorax, we have to replace that one. This is the main purpose of the our ICD tube insertion, and the question came. Okay, so what is the main purpose of the ICD tube insertion? This is the answer here, right? So here is the next question for you people. Yes, the continuous excessive bubbling, in a water seal chamber, okay, of the chest tube drainage system, what it indicates. Okay, in the chest tube drainage system, continuously we are getting the excessive bubbling. So what it indicates, bacho, there are situations all people have to know and understand because of the practical based questions may arises from here. Okay, so this is what we call as the chest tube drainage system, right? And this is what we inserted here as the chest tube chest tube. Okay, so that is the intercostal chest tube what we have inserted here, and which is connected to the chest tube drainage system tube here. Okay, yes, are you people able to notice here? This is the chest tube drainage system. Okay, and this one is the tube, and this is the ICD tube what we have inserted here. Okay, so already I have shown the image to you people. Okay, this is the ICD tube which we have inserted here into this particular patient, right? So this is the very important. So when you see the bubbling, okay, the bubbling in the ICD drainage system, you have to choose, and first you have to notice that it is an intermittent bubbling or it is an continuous bubbling. If in case it is an intermittent bubbling, then no need to worry, which is normal and which indicates the intercostal drainage system is working normally. If in case it is a continuous bubbling, then it indicates the air leak in the system. It indicates air leak in the system. So let me come to the question here, right? When the chest tube is, sorry, not this is not a question. Yes, this is the question. When you see the continuous excessive bubbling in the water seal chamber, so here what I told, it's a continuous excessive bubbling. Means the continuous bubbling means it is an air leak. Okay, so if you found the continuous excessive bubbling in the water seal chamber, the chest tube drainage system, what it indicates? It indicates that there is an air leak in the pleural cavity or in the chest tube system. So that is air is leaking means the bubbling means it is the air is continuously passing through the water means which is creating the continuous bubbling. So the continuous excessive bubbling indicates the air leak is the very important. Okay, the intermittent bubbling is indicating the chest tube is functioning correctly and draining the fluid normally. So that indicates the intermittent bubbling. Okay, so the continuous bubbling is indicating the air leak, and pleural space is fully relaxed. So pleural space is fully re-expanded or relaxed means the osculation. Okay, what we can say osculation will get absent. Okay, we can say the negative osculation or the absent of the osculation. I will tell this one what is osculation, tidaling, and how the situation based questions will arise from this one. I will tell this one. Don't worry about that. Okay, so let me come to the next question. Yes, the question is very simple. When a chest tube is dislodged from the insertion site, the chest tube is dislodged. So, what is the best nursing interventions as a nursing officer? You have to choose here. Yes, the option A is leave the tube out to allow the air into reabsorb naturally. Bacho, if the insertion from the insertion site, the chest tube came out, means there are two situations all people have to understand here, right? One is the disconnection. Okay, here look at this one. This is the chest tube what we have inserted inside the pleural cavity, and this chest tube we have connected to this draining system. Okay, so one question which will come, if in case this chest tube which we have inserted inside, which is accidentally came out, or the patient accidentally pulled this chest tube out, means the chest is having the open hole here, and it will take the immediately atmospheric air inside the pleural cavity. Again the pleural cavity pushes the lungs and lungs become collapses here. So if in case the chest tube is accidentally dislodged or the chest tube is accidentally came out, so the first priority intervention as a nursing officer we have to do here is a cover this hole of on the body of the patient. Okay, so cover this hole with a complete three-sided dressing. Okay, complete three-side dressing we have to cover this hole. Very important and first priority. Okay, in the question also happened same only when the chest tube is dislodged from the insertion site. Okay, from the insertion site only chest tube came out or the chest tube is dislodged. So now what people have to do is the immediately insert the new chest tube. So this is not possible. Okay, so then comes to the option C, seal the insertion site first and with a sterile occlusal dressing. So this is your correct answer. Okay, so this is your correct answer, right? Yes. So please wait for a second. Important call is coming. Okay, we'll take it later. Yes. So when chest tube is dislodged, the intervention is the seal the insertion site. Okay, with the sterile occlusal dressing. The one more important question which will comes, if in case this is the chest tube and this is the connecting tube, if in case this chest tube and this is the connecting tube, both are disconnected, so then this particular proximal tube which is there in the patient chest, the end of this tube we have to insert in the normal saline. So as a nursing officer, keep normal saline bottle at bedside is the very important intervention we have to do here. Okay, so because if suddenly patient got disconnection between the chest tube and the draining tube, so we have to insert the tip of the chest tube in the normal saline. Okay, so that is very importantly, that is the reason why as a nursing officer we need to keep the normal saline at the bedside. Very important question. Okay, but the question is not related to the disconnection between the two tubes. That question is related to the, yes, dislodgement of the tube from the chest of the patient, right? So the answer here is the seal the insertion site with the sterile occlusal dressing, and never ever clamp the chest tube. Okay, so because clamping the chest tube again creates the pressure in the pleural space, and which may again leads to the chance of the tension pneumothorax, and the chest become may suddenly collapses. Okay, so the lungs become suddenly collapses if you unnecessarily clamps the chest tube. Okay, never ever clamp the chest tube. Very important. Okay, so then come to the image based question. So it's very important. So what is this image which I have shown here in the particular board? Okay, so this is very important image based questions may strikes in your upcoming exams. Please say the name of the device which I am showing here. Yes, anyone please? I'm waiting for your answer. Very nice of you all. That is the Hemlich valve. Okay, okay, that is what we call as the Hemlich valve, or we can say this one as in the pneumostatic valve. Look at this image B. Here we have inserted a chest tube. Okay, and here is the drainage tube is there. In between the drainage tube and the chest tube, we have placed this Hemlich valve or the pneumostat valve. If in case accidentally the chest tube and the our insertion chest tube and the drainage tube is got disconnected, means this particular Hemlich wall, the pneumostatic wall, it will not allow the environmental air to go inside the pleural cavity. So that is the reason we are using the Hemlich wall. So what is the purpose of using the Hemlich wall or the pneumostatic? Means holding the air. Means it holds the air and it will not allow the air to go into the pleural cavity. Okay. If in case of the accidental disconnection between the chest tube and the drainage tube. Okay. So the drainage tube and the chest tube is disconnected, means the environmental air will not go inside the pleural cavity because of this Hemlich valve or the pneumostatic valve. So when there is highest risk of the disconnection, means if the patient is very serious, we are shifting the patient from the one hospital to the another hospital via ambulance. Means we are lifting the patient, we are shifting the patient, we are keeping the patient in the ambulance, means there is chance of the disconnection between the chest tube and the drainage tube. Okay, so while transporting the patient from the one hospital to another hospital, this Hemlich wall or the pneumostatic wall must we need to keep between the chest tube and the drainage tube in order to prevent, if in case accidentally disconnection happens, in order to prevent the entry of the air again into the pleural cavity. In order to prevent that one, we have to use the this particular Hemlich wall or the pneumostatic wall. It's a very important image based question. Okay, all you people have to know and understand and give the best answer. Okay, so here is the next question. The question is again very simple and very important. Okay, if there is no tidaling in the water seal chamber of the chest tube drainage system, it may indicate. So what it indicates? There is no tidaling. So what is the Tidaling? Let me clear. Okay. So this is the chest tube, what we have seen here, and this is the drainage tube. So in the drainage tube, the fluid will go up, down, up, down, up, down. So this is what we call as the Tidaling of the fluid, or we can say this one as in the circulation of the fluid. If I am inspiring the air, means this fluid will go off, and if I am exhaling the air, means this fluid will go down. So that is what we call as the Tidaling or the circulation of the fluid in the chest tube. So which indicates the normal functioning of the chest tube. If in case the absent of the Tidaling or the absent of the articulation, so that indicates what? What it actually indicates, the question is asking here. Yes, there is no Tidaling, means what it indicates. Option A, the possible blockage of the chest tube or the drainage system. The chest tube or the drainage system is got blocked. And option B is telling the complete pneumothorax. Option C is the presence of the pleural effusion. And option D is the dislodgement of the tube. Bacho, the tube is dislodged means yes, there is no articulation, no titling, nothing will be there. But this is the different situation. Okay, so but the tube in place and there is no titling means the correct answer goes here is the possibly the tube is get blocked or the drainage system is get blocked. Okay, so the two things the articulation indicates here. Okay, so articulation or the tidal. Okay, note it down. Both are present. Articulation or tidal both are same. If present means that indicates the normal functioning of the lung. Both are absent. Both are absent. No titling, no articulation. Okay, so that indicates what it indicates. It indicates the tube may get blockage of tube, or it may indicate the lungs are completely re-expanded. Lungs are re-expanded means the hemothorax what we are treating, that is cured, and lungs are completely re-expanded and came to normal means yes, that indicates if absent of the tidling or articulation, that also indicates the lungs are re-expanded, or that may indicate the blockage in the tube. Sir, the tidling and articulation which indicating the both means how I can get to know, sir, whether it may be due to blockage or whether it may be due to lung re-expanding. That is very, very importantly. So next step is the clinical examination and the radiological examination. Okay. So tidling is absent and it indicating the blockage of the tube or the lung is re-expanded. Okay. If lung is re-expanded, if you have to auscultate the lungs, means every area of the lung you will be getting the sound. Okay, so that indicating the lungs are completely re-expanded and the air is entering into the lung. So the absent of the tidling here because of the re-expansion of the lung. If in case you have noticed that the tube is blocked means that indicating that clearly we can see visibly only, or if we having the still doubt because of the two blockages having the tidling means just again auscultate the lungs area. Okay, so if you are inserted the here the left lung pleural space means auscultate the left side lung pleural area. So where if in case the breath sound is absent means the articulation is absent because of the blockage, because of the not because of the lung re-expanding. Okay, yes, tidling indicating the blockage of the tube and lung re-expansion. Next step to confirm, we have to go for the chest auscultation. The breathing sound is present means the articulation is absent because of the re-expansion of the lungs. The breathing sound is absent means that indicating the blockage is there in the tube and the articulation is absent because of the blockage there in the tube. Okay, and to confirm these both, again we have to go for the chest X-ray. In the chest X-ray, clearly we can see the lungs are re-expanded or not. Okay, so it's very, very important. And here, no tidling means the blockage of the tube. If the examiner given both re-expand and blockage of the tube means he would have given the extra question also. In question he would have mentioned the breath sound are normal in the lung fields, means that is because of the, yes, the re-expansion of the lungs, the tube is the tiling is absent. And if he have given nothing in the question means just go for the answer. The absent of the tiling or the no tiling is because of the blockage of the chest tube. Hope the concept in all dimension is very much clear for you people, right? Yes. I hope all the possible questions are clear on this one. Right. So let me golden point revision on the chest tube drainage again. Yes. The most common and important preferred size of the chest tube for the adult chest tube size. Remember always 28 to the 32 French is the best adult chest tube. All you have to insert and use. That's the 28 to the 32 French. A very important point again. Okay, and rest all things we have discussed in detail, properly, carefully, completely. That's the image based question, concept based question, clinical based question, practical based question. Yes, and the differentiating questions. Okay, so disconnection, what we have to do, dislodgement, what we have to do. Okay, everything we have discussed here in this particular uh, previous questions. Okay, so the next set question is like here. Okay, so what is the primary purpose of the Minnesota tube? Okay, what is the primary purpose of the Minnesota tube? Yes, please give the best answer in the comment box. I am waiting for your answers in the comment box. Fatapat do comment. What is the primary purpose of the our Minnesota tube? Right? What is the primary purpose of the Minnesota tube? I am waiting for your answers in the comment box. Fatapat do comment. Vaja fatapat. There is very less time. We have to cover the very vast syllabus. Right? Yes, this is used for the very good, very good. So this is used for the controlling the bleeding from the esophagus. Okay. So during the esophageal varices, there is excessive bleeding from the esophagus. So to control that bleeding and from the gastric hemorrhage also we have to control during the Minnesota tube. Sir, this concept we have heard and studied on the Sanger's taken Blakemore tube, sir. And here you are telling we are using the Minnesota tube for the controlling the bleeding and from the esophagus and the stomach means yes, this is also correct. The best preferred one is the Minnesota tube, and second best preferred one is the Sandersteck and Blakemore tube, and least preferred one is the Linton tube. Sir, the image based questions will come or not on this one, sir. Definitely, there is highest chance of the asking the image based questions from the Minnesota tube, Blakemore tube, and the Linton tube. Okay, so bacho, the Linton tube is very easy to identify. Look at this one. 3 lumens are there. Yes, sir. 3 lumens are there, and only one balloon is there. This is the gastric balloon. Okay, this is the gastric balloon. But here in the Sanger stick and Blakemore tube, 3 lumens are there. Yes, sir. 3 lumens are there. Two balloons are there. One is esophageal balloon and one is the gastric balloon. Yes, sir. In the Minnesota tube also, two balloons are there, sir. One is the esophageal balloon, one is the gastric balloon. But look at the image, also. Here we are having the 4 lumens. Okay. So here we are having the 4 lumens, and Sanger's and Blakemore tube is having the only 3 lumens. Okay. So one extra lumen is there for the continuous gastric suctioning. Okay. So to aspirate the gastric content, one extra lumen is there in the Sanger's in the Minnesota tube. Okay. So it's very important, right? So this is how you people have to identify and analyze and give the correct answer. Okay. So this is how we have to differentiate and study for the better rank in the exams, right? Right. This is first one is the Sanger's Blakemore tube, and second one is the Minnesota tube, and third one is the Linton tube, right? So all these two tubes are used to control the gastric bleeding and the esophageal bleeding, but Linton is not used. Linton is used only for to control the gastric bleeding, but Minnesota and Blakemore tube both are used for the controlling the yes esophageal balloon and esophageal bleeding and gastric bleeding also. Sir, what is this exactly? Esophageal varices. Why we have to use this Fungus-taken Blakemore tube? Let me clear that one. Okay, because there is chance of the asking question is there highest in the esophageal varices. Okay, so let me clear the concept. Okay, so it will help you people in your upcoming exams. This is the esophagus and this is the stomach, right? And this is the duodenum, this is the pancreas, this is the spleen. Okay, and here are the intestine. This all you people know this one. Okay, this is the intestine, and here we are having the beautiful liver. Okay, right. This is what you call the beautiful liver, and the veins which is draining the esophagus and the stomach and the spleen. It will comes together as a splenic vein. Okay, the esophageal vein, the esophageal vein, the gastric vein, it will connect to the splenic vein. Then comes to the mesenteric vein from here. Okay, so that is the superior mesenteric vein and the inferior mesenteric vein, which drains the intestine. Okay, and this both makes the portal vein. Okay, which makes the portal veins. Okay, so these portal veins it will get connects to the our liver, and from here hepatic vein, and from the hepatic vein to the inferior vena cava, and from the inferior vena cava to the right atrium. It will go like this, right? So if in case the liver is congested, the liver is get cancerous any tumors or any cirrhosis of the liver, means the entire the portal circulation is blocked here, means the blood which is coming here is get blocked. The blood is which is the direction of the blood will be like this. Okay, let me take a different pen and show you, so it will be very clear for you people. Okay, I will take the blue color pen, right? So the direction of the, just a second please. Yes, the direction of the bleeding will be draining of the blood in the from the veins of the esophagus will be like this. Okay, and like this, right? If the here is the block, means here it will get congest, and here in the portal vein it will get congest. From the portal vein, splenic vein will get congest, and from the splenic vein, gastric vein will get congest, and esophageal vein will get congest. So there is bleeding will start from the esophagus. Bleeding will start from the esophagus. Okay, so when bleeding will start from the esophagus, that is what we call as the esophageal varices. Okay, the question will come, what is the esophageal varices? Esophageal varices is the bleeding from the esophagus because of the portal hypertension or because of the portal overload. Okay, so the congestion of the blood in the portal system which creates the extra pressure, that is what we call the portal hypertension. Because of the portal hypertension, there is congestion of the splenic vein. The splenic vein is get congested, means the esophageal and gastric vein will get congested, and because of the congestion of the superficial veins of the esophagus, the bleeding will start from the esophageal vein. So this is what we call as the esophageal varices. Okay, so it's very important. Now the bleeding is happening from the esophagus, means I have to maintain the pressure here. So I will use the Sangastakan Blakemore tube, and I will insert the Sangastakan Blakemore tube through the mouth. How we have to insert the Sangastakan Blakemore tube? Most preferably to the mouth, we have to insert the Sangastakan Blakemore tube, and as is shown in this image, okay, Sangastakan Blakemore tube is having the a gastric balloon and esophageal balloon. Okay, so I will push the tube inside, and I will let the gastric balloon to go into the stomach, and I will keep the esophageal balloon into the esophagus, and I will inflate the gastric balloon, and I will inflate the esophageal balloon. Okay, so inflation of this esophageal balloon creates the pressure on the veins and decreases the bleedings. So this is how the Sangastakan Blakemore tube, which is used in the esophageal bleeding or in the esophageal varices condition. Okay, so most importantly, this is the thing happens here. Okay, so that's the, I hope it's the clear to everyone why we are using the Sangastakan Blakemore tube in the esophageal varices. Same here. So in the Minnesota tube also, we will insert the same here. The gastric balloon we will inflate in the stomach, and the esophageal balloon we will inflate in the esophagus. So again it will create the pressure, and again it will reduces the bleeding. Okay, but the Minnesota tube is having the one extra lumen where we can do the gastric content aspiration also. Okay, so that is the differentiating feature between the both. Okay, so very importantly, so I think the last question is clear for everyone, right? So this is the Minnesota tube is used for the controlling the bleeding from the esophageal varices and gastric hemorrhage. And remember bacho, this is the temporary method. Both the Minnesota tube insertion and the a Sangerstein Blakemore tube insertion to control the esophageal balloon to control the esophageal bleeding. Both are the temporary management. The permanent management is the tips procedure we have to do. So what is the tips procedure? That is the transjugular intrahepatic portal venous stent we have to place. So I will teach that one in the next question. Don't you have to worry about that one. Okay. So the next practical based question is like this. Okay. So what is the maximum duration for the Sangerstein Blakemore tube to be kept in the place? So as I told just now in the previous question only, it's an temporary method of the controlling the bleeding. Okay, it's not a permanent method of the controlling the bleeding from the esophagus, right? So esophagus is bleeding because of the obstruction in the portal system. So the main and final treatment is the we have to remove this obstruction from the portal system. Then the congestion will reduce and the esophageal bleeding also will get controlled. So the final treatment is to relieve this particular congestion and make this portal vein very clear to deliver the blood. Okay, so if in case it's not possible to do the permanent method, means just as the emergency method we are using the Sangerstein Blakemore tube and Minnesota tube. Once we inserted that one, maximum we can use only for the duration of the 24 to 48 hours. Okay, so if the bleeding is controlling, so that is well and good. If bleeding is not controlling, then I will go for the tips procedure. Okay, then I will go for the tips procedure. Very important. And take a practical questions again here. Okay, so yes, any doubts please mention. Yes, okay, no problem, right? So before doing the Sangerstein Blakemore tube insertion or the Minnesota tube insertion, we have to routinely intubate the patient. Routine intubation with ET tube is very much necessary. First, we have to insert the ET tube and we need to intubate. Then only we have to go for the esophageal balloon inflation. If you are not intubated the patient and if you are not kept any airway patent and you have inflated the esophageal balloon, means this inflation of the esophageal balloon which creates the pressure on the trachea will get blocked, means airway will get obstruct. So without intubation, don't do the Sangerstein Blakemore tube esophageal balloon inflation. Okay. Says the next one is the gastric balloon inflation we have to done in the two step. Why? Because look at this image. So here we are inflating the gastric balloon in the stomach. By mistakenly, if the gastric balloon is here in the cardiac sphincter or in the gastroesophageal lower sphincter, if this balloon is in this sphincter, I am inflated this balloon, means the sphincter will get damages. So that is the reason. First we have to insert 50 ml of the air, then go for the chest abdominal X-ray and confirm whether the this particular gastric balloon is inflating in the stomach or not. Okay, if it's inflating in the stomach, means yes, next to 250 ml I will add the air. So total 300 ml maximum I can put. Okay, some books suggest that the yes up to 500 ml also we can add. Yes, the maximum we can go for the 500 ml also. Okay, but routinely in the clinical practices used one is the 300 ml of the air we can put into the gastric balloon. Okay, so in the esophageal balloon, when only around 50 ml of the air we can insert, and the pressure should be less than 45 mm of Hg. Okay, if the pressure is more than the 45 mm of Hg, it definitely compresses the trachea and it blocks the airway. Okay, so very important. Remember, for the gastric balloon inflation, two-step inflation is required, and for the esophageal balloon inflation, it's not no problem. We can inflate the esophageal balloon in the one step only. Okay, so that's the very clear. Once it's inserted, we can use it for the 24 to 48 hours. And remember, once this esophageal balloon is inflated, so we have to keep for the 6 hours only. So every 6 hours we have to decompress the esophageal balloon. Means the esophageal balloons, we need to take out the air every 6 hourly. Again we have to leave for 20 to 30 minutes, and again we need to inflate. Okay, so every 6 hourly decompression of the esophageal balloon is the very important points all people have to remember and give the best answer and best shot in the exam. So this is the golden point chanting on the our what we can say, the Sangastic and Blakemore tube and Minnesota tube. And the questions from the esophageal balloon and the gastric balloon and double step in inflation of the gastric balloon, I think it's clear. Okay, and duration also is clear, I think so. Okay, so the next question is here, right? So the next question is, what is the primary indication for performing the TIPS procedure? Just only we have discussed the TIPS procedure. Okay, this is the permanent or the final management of the esophageal varices, or the, to control the esophageal what we can say, bleeding, right? As I told here, the esophagus is bleeding because of the portal system blockage. So here I need to place a stent in the portal system like this. Okay, so this is the portal vein here, and this here is the blockage in the portal vein. So I am placing the stent here. So that is what we call as in the stent keeping in the portal vein, the procedure. So here we have to come from the internal jugular vein to the right heart, from there to the inferior vena cava, from the inferior vena cava to the hepatic vein, and from the hepatic vein to the portal vein, and we need to create the stent here. Okay, so that is what I am coming from the jugular vein. So that is the transjugular, and I am going to the hepatic vein. So that is the intrahepatic. I am keeping the stent in the portal system. That is the portal system stent. Okay, so this is what we call as in the TIPS surgery. That is indicating transjugular intrahepatic portal system shunt, or the stent we can say. Okay, so that is the very important. The TIPS is the final management to relieve the obstruction from the our portal system. The obstruction release, the obstruction is released from the portal system means, yes, obstruction release means no problem. So the flow will be normal. The pressure from the portal system will decreases. The portal hypertension will decreases. The pressure from the esophageal vein will decreases. Means the esophageal vein will not bleed. Okay. So this is the very important concept. All people have to understand, know, and give and best choose and give the best answer. Okay. So hope that every point on the Sangastic and Blakemore tube is very much clear here. And most importantly, yes, before going to the main questions, so again I am here to clear some more important points. So always to maintain the controlling the bleeding in the Sangastic and Blakemore tube, so we have to tie the Sangastic and Blakemore tube to the traction. Okay, so we have to maintain some weight here. Okay, so the weight is 0.5 kg to 1 kg traction weight we have to keep. Okay, so if a patient suddenly get breathing difficulty because of the overinflation of the esophageal balloon, or because of the overinflation of the gastric balloon, which compresses the trachea and which compresses the our airway, means suddenly I have to cut this one traction, and I have to remove this particular Sangastic and Blakemore tube immediately if respiratory problem is arising. Why? Because the Sangastic and Blakemore tube is in place and respiratory problem is coming, means that is maybe because of the blockage in the airway. Okay, so that is the reason when the patient with the Sangastic and Blakemore tube or the Minnesota tube will be in your hospital, so always keep a perfect working seizure at the bedside. Okay, yes, in the just last question, that is the ICD drainage system, I told what we have to keep in the bedside. That is the normal saline bottle we have to keep in the bedside. Because of the accidental disconnection, we have to insert the chest tube in the normal saline in order to avoid the environmental air into the pleural cavity. Okay, so that is we seen in the last question. But again here in the Sangastic and Blakemore tube situation, we have to keep the seizure, okay, at the bedside. If any accidental respiratory problem is coming, means immediately cut the traction and take out the second Blakemore tube out, okay. So that is the very important golden point again on the what we can say second Blakemore tube, right? So it's very much clear, I think so. Yes, one pair of the scissor we have to keep at the bedside. Very nice of you all. Okay. So hope the concept is clear on this particular session, right? So here is the next question for you all. The question is very simple. Which of the following gases is typically stored in a cylinder with black color body and white color shoulder? The cylinder body is the black color and the cylinder shoulder is the white color. So which air we can store in this one? Right. Okay, black body and white shoulder. Yes, I am waiting for your answer in the comment box. And many of you have given the correct answer. That is the oxygen is the air we can store in the black body and white shoulder cylinder. Very importantly. So let me take to the all cylinders and with color coding because it's an high yield topic, okay, because it's very important and high yield topics, okay. Don't read this USA guidelines, just go for the iOS guidelines. That is the very important, okay. So the oxygen color coding here is the white shoulder and black body, okay, sorry, white shoulder and the black body is the color coding for the oxygen. Look at this cylinder, the cylinder number one. So here this is the black body, white shoulder, okay. The shoulder is white and body is black. So this is the oxygen cylinder. Okay. If in case the body is blue and there is white fringe in the shoulder. Okay. So white shoulder, blue body, this is indicating the Antonex. So what is Antonex? Yes, it's a mixture of the oxygen and the nitrous oxide. That is what we call the Antonex. So the cylinder of the Antonex is the, yes, a green blue body with white shoulder, okay, that is the Antonex. So then the helium cylinder color code is the brown, okay, brown cylinder which indicates the helium, okay. This chart also saying the same, the nitrous oxide is the French blue, okay. So I will show this one, the French blue. This is the French blue we can say, or we can say the a light blue or the French blue, that indicating the nitrous oxide cylinder, okay, that indicating the nitrous oxide cylinder, okay. So then comes to the medical air, that is the black and white. So like this is the black and white, okay. So don't look at the body, look at this particular part, okay. So here the black is there and middle white is there. So this black and white cylinder we can use as the medical air, okay. So we can use this one as in the medical air. Then the suction is always in the yellow, okay. Yellow indicates the suction, very important. And the black color cylinder, this is the black color cylinder, that indicates the nitrogen, okay. So this indicates the nitrogen. So this comes to the carbon dioxide cylinder. Next, that is the gray color cylinders. So that is the carbon dioxide cylinders. Very importantly. So then comes to the brown color cylinder. Already I have shown that is the helium. We have to store in the brown color cylinder. Then comes to the, yes, the orange color cylinder where we are storing the cyclopropane. We are storing in the orange color cylinder. Sir, whether we need to remember all or not, sir? Yes. So what I am highlighting here, that you people definitely have to remember. Oxygen cylinder color code, that is the white shoulder and black body, definitely you have to remember. Then the Antonex, what I showed, this is the updated and important trending one. That is the Antonex. Also, you people have to remember. Okay, blue body and blue and white shoulder. So that is the Antonex. Okay, very important. This one you people have to remember. Again, the carbon dioxide gray color one. Okay, this one also a triple star. Then the cyclopropane orange. This one also triple star. Okay, so all these points what I am highlighted here, this one definitely have to remember. And rest all, if you are remembering, means very good and very nice. If not possible, forget it. Okay. Yes, it's possible if you practice us 2 times at least. Okay. So here is the next question. Here is the next question for you people. So I am waiting for your answer in the comment box. But do comment for the question. Right? So which of the following is the high flow oxygen delivery device? And in the mentioned particular options, you people have to choose the high flow oxygen delivery devices. Option A, nasal cannula. The maximum flow rate is 1 to 6 liter per minute only. It's not in high flow. It's a low flow oxygen device. The nasal cannula is the low flow oxygen device. Then comes to the simple face mask. We can deliver oxygen of the 6 to 10 liter per minute. Yes, 6 to 8 is also correct. 6 to 10 is also correct. And best and better answer is the 6 to 10 liter per minute is the best and better answer. Okay. Yes. So only 10 liter we can deliver by using the simple face mask. So this is one is also considered under the low flow oxygen delivery. There is the simple face mask also in the low flow oxygen delivery. So by using the non-rebreather mask, so we can use this one 10 to 15 liter per minute. But from the non-rebreather mask, you are giving only 10 liter per minute means it will maintain around the 80 percentage to the 99 to 100 percentage. Okay, so it will maintain the 99 to yes, it will maintain the 99 to 100 percentage at the 10 liter per minute only. So there is no need for giving the 15 liter per minute. Only accepted some emergency situation only we will give the 15 liter per minute. So rest all condition, if we are giving the 10 liter per minute, it will maintain the oxygen saturation between the 80 to 100 you consider. Okay, remove this 99, it will get confusion to you people again. Okay, so just mention 80 to 100% is I can deliver the oxygen. Okay, so in the low flow rate only I am delivering the highest concentration of the oxygen here. Okay, so that is the also which we consider under the low flow oxygen delivery only. So HFNC is the yes high flow nasal cannula. So full form of the HFNC will come in your exams. So it is the high flow nasal cannula. Okay, so this will is considered under the high flow oxygen delivery system, and this remaining all will consider under the low flow oxygen delivery system. Okay, so remember the two very important things which will coming under the high flow oxygen delivery system. Okay, one is the HFNC, that's the high flow nasal cannula, and another one is the Venturi mask. Okay, so these both HFNC and Venturi mask are mainly comes under the high flow oxygen delivery devices, and remaining simple face mask, nasal cannula, nasal catheter. Okay, and other one is like non-rebreather mark, partial rebreather marks. This one will comes under the low flow oxygen delivery devices. Okay, so hope the concept is clear, and correct answer for this question is the our option D is the correct answer. Okay, so here comes to the next question, right? So which of the following oxygen delivery devices can provides the precise oxygen concentration? So precise oxygen concentration means the precise oxygen concentration means accurate rate and concentration of the oxygen. Okay, if you want to deliver only 2 liter per minute, so you can deliver this one. So this is not a variable, this is the accurate. Okay, so it will not vary the flow. Okay, it will be accurate. Okay, the most precise oxygen concentration and most accurate oxygen concentration we can deliver by using the Venturi mask. Okay, so the question will come, most accurate method of the delivering the oxygen is the or most precise concentration delivering method is the Venturi mask. Okay, so simple face mask, nasal cannula, and non-rebreather mask are the variable devices. Okay, not precise or the accurate devices. These are the variable devices where the flow rate and concentration may slightly varies. Okay, we can't deliver the oxygen accurately and precisely. Okay, so that is the very important. So let us revise and discuss some golden points on the Venturi mask. Okay, so this is the image based question from the Venturi mask. This is the IBQ, that is the image based question from the Venturi mask. Okay, so these are the color codings of the Venturi mask. Okay, so how to remember this one, sir? Remember that one. Yes, bullet is white or yellow. Raju granted. Okay, Raju granted it. ओके सो बुलेट व्हाइट कलर का भी चलेगा येलो कलर का भी चलेगा मेरे को चाहिए तो चाहिए ओके बुलेट इज व्हाइट और येलो राजू ग्रांटेड इट ओके बुलेट बी हियर स्टैंड्स एज द ब्लू ओके सो ब्लू कलर इज द B. White here stands as the white. Okay. Then or stands here as the orange. Then yellow stands here as the yellow. Then Raju stands here as the R stands here as the red. Then granted G stands here as the green. Okay. So yes, the bullet is white or yellow. Raju granted it. Okay. So that is the blue, white, orange, yellow, red, and green. Okay, so these are the color codings of the Venturi mask. Okay, so here all the people have to know that this one will be 2 liter per minute, 4 liter per minute, 6 liter per minute, 8 liter per minute, 10 and 15 liter per minute. Okay, so there is a 2 liter, 4 liter, 6 liter, 8 liter, 10 liter, and the 15 liter per minute we can deliver the oxygen. Okay, so very importantly, then it will give a 24 percentage of the concentrated oxygen and this is 28 percentage of the concentrated oxygen. Okay, then it will give the 31 percentage of the concentrated oxygen, then it will give the 35 percentage of the concentration oxygen, then it will give the yes maximum 40 percentage of the concentrated oxygen and it will give the maximum 60 percentage of the concentrated oxygen. बच्चों focus over. I am giving 15 liter per minute of the oxygen and it is providing very low concentration, that is the 16 percentage, 60 percentage only it is providing the concentration. So the question will come, the high flow low concentration device, the question will come, identify the following as a high flow low concentration device. That is the Venturi mask is considered as the high flow low concentration device. Why? Because this Venturi mask, if we are providing 15 liter per minute of the oxygen, means only it is delivering the 60 percentage of the oxygen concentration. So we consider as a high flow, means the flow rate is very high but the less concentration. Okay, so the Venturi mask is considered as the high flow low concentration oxygen device. So it's on very important. Okay, so hope the concept is clear on the Venturi mask. Okay, so another concept which will come, the best method of oxygen delivery in the COPD patient is the Venturi mask, right? So I hope all the questions on the Venturi mask is clear here to you people, right? Any doubts you can ask the question. Okay, so let me revise the golden point chanting on the Venturi mask. The most accurate oxygen delivering system is the Venturi mask. Most precise oxygen delivery system is the Venturi mask. The maximum flow rate of the oxygen delivery system is of the Venturi mask is the, we can deliver a 15 liter per minute is the maximum flow rate we can keep, and maximum concentration of the oxygen we can deliver is the 60 percentage only, means it's a low concentration. In the high flow rate only we can achieve the 60 percentage of the oxygen concentration only. Okay, so that is what it is considered as on the high flow low concentration device, that is the Venturi mask. Okay, so then maximum oxygen wastage happening in which devices to deliver the oxygen, that is the yes maximum loss or wastage of the oxygen happening in the while delivering the oxygen through the Venturi mask. How means, okay, so as I told here in the previous one, okay, so here just by using the non-rebreather mask, I am keeping it in 10 liter per minute. It's giving the 80 percentage up to 100 percentage of the saturation. But here I am using the 15 liter per minute, still it is getting 16%, 60% only. Means rest all oxygen is wasting here. So which devices causes the maximum wastage of the O2 while delivering, means that is the venturi mask causes the maximum wastage of the oxygen. Okay, so most important, right? So all the things we have discussed on the venturi mask. Okay, remember the golden point: high flow, low concentration, accurate method of the delivery, and blue color one is the best method of the delivering the oxygen in the COPD. And repeatedly, the examiner asked the question on the red color venturi mask, flow rate and its concentration of the delivery. Okay, so this is many time asked question on the red color. Okay, so this was there in the last Norcet also. The red color venturi mask delivers the 10 liter per minute of the oxygen, and it gives the only 40% of the concentration in the oxygen. Okay, so that is all and everything related to the our very important venturi mask. Okay, so then comes to the next and very important question, that is the what is the typical oxygen concentration provided by the simple face mask. Okay, so what is the typical oxygen concentration provided by the simple face mask? Okay, so simple face mask provides the oxygen, okay, at the rate of the 6 to 10 liter per minute. Okay, some book says 6 to 8 liter per minute. So which, if both are in option, means which one we have to choose? Choose the 6 to 10 liter per minute as the best and first answer. This one is the choose as the second answer. Anyhow, the examiner will not give both in the option. Okay, so this will be the range, and the best range is the 6 to 10 liter per minute is the best range, right? So maximum oxygen we can deliver here is the, that is 40 to 60% is the oxygen concentration we can deliver here, and almost all you people have given the correct answer. Okay, so let me revise some golden points on the simple face mask. Okay, so yes, this is the image based question on the simple face mask. Okay, so the golden chain pointing on the golden points chanting on the simple face mask is the, yes, the flow rate of the simple face mask is the 6 to 10 liter per minute. The maximum oxygen concentration we can deliver by using the simple face mask is the, yes, 40 to 60% is, so maximum is the 60% of the oxygen we can deliver. Okay, if you are giving the 2 liter per minute oxygen and 5 liter per minute of the oxygen, simple face mask not use. Okay, it's an no use, because to deliver the oxygen from the simple face mask, at least 6 liter per minute of the oxygen is required. Okay, if you want to deliver 2 liter per minute, 4 liter per minute, 5 liter per minute of the oxygen, means use the nasal cannula. Okay, or you can use the nasal prongs. So if you are delivering the oxygen less than 6 liter per minute, the oxygen mask is not prepared. Okay, so if you are delivering more than 6 liter per minute only, so then oxygen mask is preferred, otherwise it is not in use. Okay, the question will come, which one is the most common oxygen delivery system in the emergency? So which one is the most common and best oxygen delivery system? That is the simple face mask is the most commonly used oxygen delivery system in the emergency situations. Okay, so this one don't use in the patient with the anxiety. Okay, the patient came with a myocardial infarction to your emergency room, and you are keeping the simple face mask, means the patient may feel that something is applied to him and he is about to die. He will think unnecessarily think, and this mask creates the extra anxiety. The extra anxiety creation means again heart will beat more fast, and heart will demand for the more oxygen. So it will be not prepared in the myocardial infarction patient. Okay, so deliver the oxygen. The in the MI, the best one is the, for high concentration we can go for the other methods, there is the HFNC. Okay, and if not possible, go for the nasal prongs, that's the important. Okay, but still in the emergency situation, most commonly used one is the simple face mask. Okay, simple face mask don't use in the claustrophobia case. What is the claustrophobia? Claustrophobia means the fear in the closed space. Okay, if I close the door of the particular ward and I kept the patient in that ward, means the patient will fear because of the closed space. Okay, that is what we call the claustrophobia. Same, I have applied the mask here, means it will cover the patient face, so patient will feel more anxiety. So the simple face mask is not used in the patient with the claustrophobia, and don't use in case of the anxiety. And the most important golden chanting point on here is the best method of the oxygen delivery in the emergency is the our simple face mask. Okay, and image based question on the simple face mask, and all flow rate and everything, the concentration on the simple face mask is clear here. Okay, and again it's not used in the case of the excessive vomiting also. If the patient is getting excessive vomiting, if you kept the face here means face mask here means it's difficult to vomit for the patient. Okay, so don't use in the excessive vomiting also. And most importantly, patient is unable to what we can say drink or eat if you are using the simple face mask means it's a discomfort to the patient. So it's not recommended for the long term use. Means the simple face mask is not recommended for the long term use. It creates difficulty in the eating and drinking. Don't use in the vomiting patient, and don't use in the anxiety patient. The best method in the emergency is the simple face mask, and oxygen delivery system in the emergency is the simple face mask. The minimum to maximum flow rate is the 6 to 10 liter per minute, and maximum oxygen concentration we can deliver by using the simple face mask is the 40 to 60 percentage of the oxygen delivery system we can use here. Okay, so this is a best regards from the master nursing classes, and the best shot for your upcoming Norcet and RRB exams. Okay, see here we are doing the golden point chanting and high yield concept to deliver the most important content to you people. So again, I will come up with the best session in the tomorrow's class. Okay, stay connected, stay motivated, and if anyone you want to discuss your doubts in our WhatsApp group means we are having the beautiful WhatsApp groups. Okay, already 3,500 plus what we can say individuals or the aspirants, they are already participating in our group discussion, and they are clearing their doubts by messaging in the WhatsApp groups. And if you want a free quizzes for the your RB exam sign or Norcet exam means you can join to our Telegram group also, where we are delivering the free quizzes. Okay, and if you want a best or test series in the India means yes, we are having the best test series in the India. Okay, so that is the Vande Bharat test series. Vande Bharat test series for the RRB Nursing Superintendent exam, and Norcet special booster for the upcoming Norcet 8 exams. And if you want both RRB and Norcet 8 means we are having the sure selection test series for the both Vande Bharat RRB and Norcet 8 exams. Okay, so how you will get this test series? You can download the Master Nursing Classes app from the Google Play Store, where you will get the link. The link is in the description box, and the link is in the comment box. So stay motivated, stay connected. If the content is found helpful to you people, so please do like the session and give the 5 thumbs up. How many thumbs up? 5 thumbs up in the comment box. Okay, so we'll meet in the again next session with a very dhamakadar questions. So the questions which will come in our upcoming exams with the same option, same concept, and the same points what I am delivering here. Okay, so let us meet in the next section. Tab tak ke liye Jai Hind, Jai Bharat. Take care. Bye bye.